Hey, it's Patricia Murphy. It's Wednesday. This is Seattle Now. It takes a lot of trust to roll up your sleeve and let someone you don't know inject you with a brand new medication. For many people, that trust is no big deal. But for Black Americans, that leap can be much more difficult, and there's historic reasons for that. Sandy Williams is working to rebuild that trust and encourage Black people in Washington to get a COVID vaccine. She'll tell us what she's learned in a minute. But first, let's get you caught up. King County has confirmed a case of the South African COVID variant. It's the first time the variant, known as B.1.351, has been found in Washington state. Public Health says the patient tested positive for COVID-19 more than 3 weeks ago, but the UW Virology Lab identified the variant Monday. Washington state has also had 39 cases of the UK B.1.17 variant. Another strain from Brazil hasn't shown up here yet. Even in unprecedented times, some things never change, like Seattle's blistering hot housing market. New data show housing prices in and around the city grew almost 14% in December. The one notable change, more folks are buying outside Seattle's city limits. Thanks, remote work. And state fish and wildlife officials say keep those bird feeders down for a while longer. A salmonella outbreak has been killing songbirds, and dirty feeders are just ripe for transmission. The state says, why not take them down until April? That way, the birds will forage rather than flock, and that will really help stop the spread of salmonella. COVID has hit Black communities hard. Black people in Washington are getting sick with COVID at about twice the rate of white people. But when it comes to vaccines, only 2% is reaching Black arms, even though 4% of the state is Black. Part of the reason is historical broken trust between Black communities and the healthcare system. Sandy Williams knows this. She's getting involved to help bridge that gap. She's an activist and founder of Black Lens News, a monthly paper in Spokane. Hey, Sandy, good to have you.
Hi, thank you for inviting me. I appreciate being here.
So we mentioned a bunch of numbers. Help me unravel this just a bit for people, because the statistics around COVID may be fresh, but the root problem was deeply entrenched long before COVID.
It was interesting when the country was moving excitedly forward towards the possibility of there being vaccinations available. And behind closed doors, when Black people were by themselves, there was sort of this kind of, I'm not so sure. And, that started happening. It just felt like there needed to be an opportunity to explore that more. Where was that coming from? What was the hesitancy about? That kind of stuff. And so that's what got me moving forward. There's not a lot of trust between the Black community historically and the medical community, and that does not mean there aren't good medical people, but I'm talking about a system that has not been particularly good to Black people over the years. Even recently, it was circulating all around Facebook. There was a Black physician who was documenting her treatment by the hospital as she died of COVID.
I'm hearing you describe a lot of painful things. There's a nuance to your everyday care that sends a message to you. I'm curious about your experience in the healthcare system.
I'm laughing as you say that. I don't really do doctors, to be truthful, which is not uncommon. It isn't even so much that there's overt racism, but it's a lot of not feeling comfortable, not looking around and seeing anything that makes me feel welcome there, not feeling listened to, not feeling like what I share is taken seriously. So it's sort of built on, like over the years, sort of built on that, and just kind of like, I think I'll just take care of this on my own. And unfortunately, that happens way too much. Black people are disproportionately impacted by just about every negative thing health-related that exists. A good chunk of that is because we don't seek medical attention or medical care until it's way too late. how you address that, I think, is the same way that we are attempting to address the skepticism around the COVID vaccine, is you have to build trust between the Black community and the medical community. You have to do that. And just because it's a Black person in the medical community doesn't sort of take away the fact that the whole system feels not trustworthy. So there's a lot of work that needs to be done to sort of bridge that gap.
You know, after everything you just told me, it's really not surprising that people in the Black community don't want to line up to be vaccinated. Sandy, tell me how you're trying to bridge this gap. You hosted an event over the weekend.
Yeah, we did. So we hosted an event. It's called How Do Black Folks Really Feel About the COVID Vaccine? The intention of it was just to give people space to talk about how they felt, because I think that's important. You can't move to the solution until you give people the space to talk about why they don't necessarily want to go down that road. And so we had a panel of 11 Black. They were all Black, which was important to me. Medical professionals. We had a couple of physicians, a pharmacist, pastor, city council member. So it was a really nice cross section of folks from the community. And so how we're trying to address it is to create space for people to get questions answered from people that they trust, and creating an opportunity for there to not be pressure for you to feel one way or another, and then let people make up their minds.
There's so many important things in what you were saying, but I want to start with some of the concerns you heard from people. What were people actually saying?
Mostly it was around trust. So whether that trust presented itself in lack of trust in the vaccination itself and the whole process of how the vaccine was created, and there was some skepticism around how quickly it was approved by the government, and does that mean that it's trustworthy or not? There was some lack of trust in understanding how it works. There's a lot of stuff floating around about what it actually does to your body. There's mistrust in the motives of the medical system and the medical personnel. So everything sort of boiled down to trust.
Do you feel like you were able to address that mistrust in that meeting, or was this merely a starting point in some ways?
I think of both. I think we did a poll at the end where we asked people if they were more or less likely to get the vaccine or if it stayed the same. And it was overwhelmingly that people expressed that they were more likely to get it. But I also think this was a first step. I think it was a beginning of a conversation, a really important conversation that's not just about the COVID vaccine, but that's also about health in general and wellness in our community, and what does that look like. And it's the beginning of us creating spaces for Black people to come together like that and have those conversations amongst ourselves, which you don't get to do very often over here. So that's important too.
The other thing you brought up that I thought was really interesting is the messaging from, public health versus the community. Here in King County, we are running these mass vaccination sites in Auburn and Kent, and now they're trying to address this disparity, this inequity in vaccine distribution, and they've opened these up, but you also have to get people to line up. And I wonder, maybe mass vaccination sites run by the county are not specifically the answer for the Black community. Is there a different, better way that maybe we can reach folks?
Well, I think it's both. I think for some people it'll work. Like I said, we're not monolithic. So there are some people who are savvy about systems, who don't care about standing in lines, all that kind of stuff. And that would work fine for them. I walked my mother through the process of trying to get her signed up for our mass vaccination site here, which took 3 hours. My mom's 86.
Whoa.
Cannot imagine somebody trying to navigate that on their own, because I was tired of it.
You need a nap in between there.
Exactly. So that's not necessarily the way. If you already have folks who are mistrusting a system, and then you put all these barriers, you got to jump through all these hoops to get to something that you don't trust in the first place. I don't think that it should be surprising to anybody that the numbers are the way they are. So is there a way to do it better? Sure. I mean, we're advocating for community clinics that are held in places that people already feel comfortable. I was saying to the folks here, why don't you roll up a van in front of the barbershop? I mean, that's where we are. We're at the barber shop, we're at the beauty salon, we're at churches, we're at community centers. Those are the places where folks already go. They already feel comfortable. One of the poll questions that we asked was where people would feel most comfortable getting their vaccination. The highest one was a medical clinic.
Really?
That was number one, which was also surprising for me. And so maybe there's a way we can do them at medical clinics, but just change the way they're done so that people feel more comfortable, or change who's inviting you to the clinic so that you don't have to, go on an automated system to sign up. Perhaps you can sign up through the NAACP or something like that. So I think there's ways we can do it, even with our existing systems. And I think it's going to take all of that. There are enough people that need it in enough different ways that I think it's going to take everything for us to reach everybody.
Sandy, before I let you go, we talked a little bit at the beginning about historic mistrust in the medical system and your own reluctance to go to the doctor. Why are you such a good advocate for vaccines?
Because too many people have died. I have relatives that have passed away. I have a dear friend who lost 5 members of their family. My family is from the South, and one of our churches, they had to shut the whole church down because so many people were being infected. So the impact is real. It's huge. It's devastating. It's not that I hate the medical system or anything like that. I think there's value in it. I think it's important. I think we as a community need to be healthier and generationally healthier. And I think there are ways you can do that. And I think we can start working together, the Black community, communities of color in general, and the health systems to start figuring out how we can work together to achieve these goals. And there are efforts like that are starting, and I think they're important, and I think it'll make a difference.
Sandy Williams is an advocate and founder and publisher of Black Lens News. Thank you. Pleasure to talk to you.
Thank you for inviting me. It was a pleasure talking to you.
Seattle Now is produced by Clare McGrane, Caroline Chamberlain Gomez, and Jason Pagano. Matt Jorgensen does our music. I'm Patricia Murphy. See you tomorrow.